Alright, so I'm going to come in, check the doctor's orders, the nurse's notes, and the vital signs. And then I'm going to perform hand hygiene and come and introduce myself. So, hi, my name is Kaitlyn and I'm a student practical nurse. And then I'm going to get two identifiers from the ID band on the baby and the mom. And then I'm going to explain the procedure. So today we are doing a newborn assessment. And then I would gather all my supplies. So you need paper, diaper, a blanket, a scale, a thermometer, a tape measure, a stethoscope, a millimeter, and an O2 monitor. So first I'm going to start with respirations. So you're going to listen to the respirations without disturbing the baby, and you're going to listen for a full minute, and they should be between 30 and 60. And while you're doing those, you're going to note the rate, the depth, quality, and if there's any signs and symptoms of distress. And then after that, you're going to go into listening to the apical pulse. So I'm going to take my stethoscope, and this is located at the fourth intercostal on the left sternal border. And I'm going to listen for a full minute. And it typically should be between 110 and 160 beats per minute, and it may be irregular. And you should do this when the baby's at rest. And then next I'm going to move into auscultating the chest. So I'm going to take my stethoscope again. I'm going to start at the aortic, which is on the right sternal border at the second intercostal space. And then go to pulmonic, which is at the left sternal border at second intercostal space. And then go to Erb's point, which is just left of the sternal border at the third intercostal space. And then I'm going to go to tricuspid, which is the left sternal border, fourth intercostal space, and then down to mitral, which is on the left sternal border, fifth intercostal space. And then I'm going to keep my stethoscope because I'm going to be auscultating the bowel sounds. So we're going to start in the right lower quadrant and go to the right upper, to the left upper quadrant, and down to the left lower quadrant. And then if there's no sounds present, you should listen for a full 5 minutes in each quadrant. And then after that, I'm going to take the axilla temperature. So take my thermometer, and you place the tip of the thermometer in the middle of the axilla, and you're going to place the arm closely by, and you're going to hold this for 1 minute until the thermometer beeps. And then typically a good temperature would be 36.5 to 37. And you can also do a rectal temperature, which you would put petroleum jelly on the silver tip of the thermometer, and you make sure the baby is lying on their back, and you would put their legs up, and you would insert the thermometer 2.5 centimeters, and you would hold that for 1 minute until the thermometer beeps. And then after that, you would take the blood pressure of the upper and lower extremities on the same side, and then you would, after you take it, you would note any variation between the two. And normal range is 65/30 to 95/60. And then after that, I'm going to take the O2 saturation. And I don't have an O2 monitor, but typically, depending on which one you were doing, you would just clip it onto the hand or onto the foot. And the normal range is 92% within normal limits. And then I'm going to weigh the baby. So typically you would have a bigger scale like this that the baby could lie on, and it's like this long. So it looks like a little table. And then you would lie the baby on it, and you press on, and then the weight will come up, and typically the normal weight would be between 6 and 9 pounds. And babies will lose 5 to 10% of their birth weight. It's because of all the excess fluid, but they should regain that weight within 2 weeks. And you should weigh the baby at the same time daily. Next, I'm going to measure the baby. So they're already lying on a piece of paper. So you're going to make a line at the top of the head and at the bottom of the foot. And then you would take your measuring, and you would measure from there to there. And a normal range would be 46 to 56 centimeters. And then after that, you're going to measure the circumference of the head. So you would go just above the eyebrows and around the head, and a normal range. And while you're doing that, you're also looking for any lacerations of the scalp or any molding or anything. And normal range for that is 33.5 to 35 centimeters. And then I'm going to assess the fontanelles. So while doing that, the anterior fontanelle is found at the top of the head, and it's in a diamond shape. And then the posterior fontanelle is found at the back of the head. It's in a triangle shape. And typically the posterior fontanelle ossifies at the end of 2 months, and the anterior fontanelle ossifies between 12 and 18 months. And then I'm going to move on to the ears. So you're looking at the size, the shape, and the symmetry, and you're making sure the eyes and ears are in a line with each other. And typically the ear canal may contain vernix or amniotic fluid. And then you're going to do a hearing test, so someone could rattle something or talk, and whatever the baby's doing, if they're sucking on something, they will move their head towards the noise. And then after you do that, I can move the tip of the ear down to the earlobe, and you would let it go and then see how long it takes back to go to its normal position. And then I'm going to go to the nose. So I'm going to be testing the nose for the nasal airflow. So I'm going to occlude one nostril and make sure the baby can still breathe out of the other one, and I'll do the same with the other one. And then I'm also looking to identify any maleas, which is like little bumps around or on the nose. And then I'm going to move to the eyes. So I'm just making sure the pupils are the same size, the eyes are symmetrical, and they're in the right position. And then I'm noting if anything's out of range or anything like that. And babies are nearsighted, so it's good to have face-to-face interaction. And then I'm going to go to the mouth. So with the mouth, you're going to be assessing the palate. So you're going to place your finger in the baby's mouth and make sure that the palate is intact and everything's good. And you're also looking for assessing for Epstein pearls, which is like little white or yellowish bumps on the inside of the gums or the roof of the mouth. You're also assessing the lips and if the baby is tongue-tied. So after that, I'm going to go to do the bilirubin reading, which is a little test to see what the bilirubin levels are high or low. If they were low, that's okay, that's good. But if they were high, you have to get the baby's heel pricked to see what the actual level of bilirubin was. And then I'm going to assess the neck and for a head lay. So how you test for that is you would take the baby's arms and you're going to lift the baby up, and their head should come with them, and it shouldn't be just dragging on. And you're going to sit, they're going to sit up, and you're going to, their head, they should be able to hold their head for 2 to 3 seconds without, and then fall. That's good. And then I'm going to check the circumference of the chest. So I take my tape measure again, and you're going to measure right at the nipple line and go around. And this, the normal range for this would be 30.5 to 33 centimeters. That's good. And then I'm going to assess the clavicles, and they're symmetrical. There's nothing out of the ordinary. And then I'm going to assess the nipples, making sure they're symmetrical as well. And I'm just noting they should be the size of like a dime, so about 5 millimeters. And that's good. And then I'm going to go on to the assessing the hands and fingers. So the hands are good, and you're going to count the fingers, make sure there's 10. It's good. And you're going to do a grasp reflex. So you're going to place your finger in the palm of the baby's hand, and they should wrap their fingers around it. And then I'm going to move on to the umbilical cord. So the umbilical cord is just like 3 vessels. So you're going to assess the clamp, and you're going to assess for any bleeding, and the clamp can come off after 24 hours. And then you're going to do umbilical care. So you're going to make sure it's clean and dry, and that'll typically fall off within 10 days. And then I'm going to just assess the abdomen, which is all good. And I did the bowel sounds earlier, and just did the umbilical care. And then I'm going to go down to the legs, and I'm going to make sure that the legs are the same or even in length and they're good. And I'm going to assess the hips. So to do that, you're gonna grab the baby's thighs and you're gonna push up, and there should be no movement there. And if there was, you would hear like a clunk noise, and that would be an indication of a dislocation. And then I'm going to move on to the baby's feet and toes. So here, you're gonna count the toes. Make sure there's 10. That's good. And you're just making sure that everything's good with the feet, and you're looking for any creases in the sole of the foot. And then after that, I'm going to assess the spine. So to do that, I'm just going to place the baby like this. And here, I'm just going to be looking down the spine to make sure it's straight. There's no curvatures or anything. And then I'm going to be assessing from the base of the head down to the coccyx. And then I'm also looking for any dimples or any hairs or any like openings or anything like that. And it's good. Place the baby down, and then I'm going to be assessing the GI tract. So the baby should be voiding several times a day, and for bowel movement, you want to know how often, the amount, the consistency, and the color. And the anus should also be closed. And then I'm going to be checking the female genitalia. So the labia is formed and the majora covers the labia minora. And just looking for any signs of edema, because there normally is some present. And then there's the male genitalia, which is, there's a small amount of rugae on the scrotum, and the testes descend into the scrotum. And then I'm also looking for any edema there too, because there could be some present. And then after that, I'm going to do a few tests. So I'm going to do the Babinski test first. So you're going to take an object and run it up the baby's foot, and the toe should go up and the other toe should flare out. And then the plantar reflex, you would take a blunt object and just tap it on the sole of the foot. And then there's the startle reflex. So you're going to take your baby, and as you go to set them down, you're going to just lean them a bit so they're kind of upside down, and their arms should flare out. And that is the newborn assessment.